Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health. Hope you're all doing well. Beautiful Tuesday here in the great city of New York. Just want to share some updates on long hauler syndrome. Many of my colleagues, many of my patients in the local area and through virtual technology are expressing a lot of what we call long hauler syndrome. Now, unfortunately, for those with the long hauler syndrome, it really refers to the idea of symptomology over a 4 to 6 week period of time. So they get sick, they contract COVID, and they have these symptomologies that last for a period of time. COVID-19 has been really interesting in that we really need a uniform approach to keep our population healthy. We can talk about it all the time. We have an unhealthy population. Only 12% of our population is metabolically healthy. That's 1 in 7.5 people. So again, if I were to see 30 people in a day, only 4 in theory would be metabolically healthy. We also have about 42% of the population obese, 75% of the population obese or overweight. So we're dealing with an unhealthy population. Most people's immune systems are not robust. They're not responding well. And if they don't respond well to an attack from a novel virus, they may not even respond well to a vaccine. So we want a uniform approach to keep our population healthy. What I've called COVID-19 is, for me, it's actually a transmissible metabolic health disorder. Positive COVID-19 has a downstream effect on what we call insulin mechanism. Insulin is an interesting hormone in that insulin is the transport for sugar to get into specific cells. So my take and what I've seen very interestingly is that if you've got an issue with insulin or blood sugar dysregulation, you have a higher propensity, data backs this up, to have a positive test for COVID in a longer duration of time where you're ill. Also, inversely related, a lower amount of insulin that's expressed and blood sugar dysregulation has shown to have a positive outcome, have a better immune system. 300 calories of carbohydrates at one time decreases your immune system by 50% for a 2-hour period. So that's really taking down your inner vests, if you will, vests of immunity. So my take, interestingly enough, from some of the newer literature out there is COVID-19 unmasks some insulin-resistant tendencies. You may not be showing it. You may be on the threshold. The metaphor I use is the grass looks great in front of your house. You kick the grass. You couldn't see the snake, but now the snake comes up. Same idea with these insulin tendencies. So there's 2 arms to this all. They're beta cells. They're beta cells in the pancreas. Those beta cells release insulin. Interestingly enough, the beta cells have ACE2 receptors. As we all know, these ACE2 receptors are where this novel triple spike protein virus can come and lock with tremendous affinity. COVID-19 can therefore enter the pancreas quite easily. It stimulates or has a hyperstimulation, if you will, of beta cells. That ultimately produces excess insulin. This actually can also trigger autoimmune effect on the beta cells. So just in the actual idea of in the beta cells, it's by attack from the virus, it releases extra insulin. So when you have too much insulin and there's no insulin to match or lock and key with sugar, you now have what we may call insulin resistance. Also, because there's such a high propensity for autoimmunity, you attacking yourself. Diabetes is an autoimmune disease. You have that negative effect where you're attacking the beta cells and just blowing them up. There's a second arm to it all. Believe it or not, interfering with what we call insulin signaling. How this happens is this release of excessive amount of cytokines. Cytokines are protein enzymes that are released at the time of inflammation. They come from a signaling pathway called NF-kappa B. Ultimately, cytokine storm, very common in COVID-19, interferes with insulin signaling, which can lead to what we call type 2 diabetes or type 2 resistant diabetes. It can also ultimately cause type 1 diabetes on beta cells. So some of the newer literature in this metabolic health really is extremely deleterious to the pancreas beta cells and insulin resistance. Once again, it's like kicking the grass and the snake coming up. So what's my ABCDS for metabolic health? The reason the S is it's for everybody. Number 1, A, activity levels. Increase your activity levels. Let's get moving. 30 minutes a day, 5 days a week. Let's get moving. Some of the interesting things people say, I'm killing myself. I'm doing what we call HIIT, high intense interval training for exercise. That's great. It's good for your heart. Shouldn't do it every day. You exercise too hard, which is not most of Americans, but if you exercise too hard, you have an elevation of inflammation. Let's get moving. Let's get mild to moderate movement. Let's get walking 15,000 steps a day. Let's get some resistance training. Let's get some flexibility training. B, breathing. Let's do more nose breathing and less mouth breathing. Let's get the diaphragm involved. You get the diaphragm involved, you get that phrenic nerve. You get that diaphragm with some deep breathing, you may stimulate your vagus nerve. Your vagus nerve is a critical element. It's cranial nerve number 10, goes from the medulla oblongata, down the bottom of the brainstem, down through the transverse colon. It allows for the parasympathetic system to be upregulated. Modulation or elevation of the parasympathetic nervous system, that vagus nerve, its key function is to decrease peripheral inflammation. You can do so and affect it positively by proper breathing. How about some cardio exercise? Get moving, get that cardiovascular going, get that heart working a little bit. I see a lot of people, they just weight train. It's wonderful, makes you look good. Muscle mass is a critical element. The loss of muscle mass is the first sign of aging. We call that loss of muscle mass sarcopenia. But you really want that cardiovascular exercise, great for heart health. D, nothing more important than the D, diet. You are what you eat. You are what your food is eaten. You are what your food has been exposed to. So diet is a critical element because food is a potentiator for inflammation. Good food is a potentiator for information. Got to have a good diet. Some real key takeaways: more organic, whole foods, limit your sugars, eat quality proteins, eat quality fats, more organic coffee. Please be hydrated, drink more appropriate water. The S, stress. I can tell you this, everybody appears to be a little stressed. We're out of our schedule. That's another part of the S. Please stick to a schedule. Human beings like a schedule. As long as they're in a schedule, we are calm. We know what's coming next. When we don't have that schedule, we lead to stress. And lastly, in the S, sleep. Without question, it's rejuvenative. Sleep also is the ability to recover. Your immune system can become rejuvenated with good quality sleep. Some people have been emailing me about lab panels, and lab panels where you can get from your medical doctor or any functional medicine practitioner like myself, lab panels for metabolic health. These are easy. These are basic tests. There's nothing difficult. It's not like when I talk to my good friend, Dr. Lauren Marks, who knows every lab test ever created, and he's a genius when it comes to that. Here are some very basic lab panels for metabolic health. A good quality lipid panel. That's a starting point. I much prefer an advanced lipid panel where you're looking at the particle size of the lipids, when you're looking at specific inflammatory markers to see if these lipids. So everybody, whenever you go to your practitioner and you want to get your metabolic health or just a regular checkup, ask for an advanced lipid panel. Fasting blood glucose, very simple. The fasting blood glucose will tell you where your sugar is at that point. Hemoglobin A1C shows the average of your blood sugar over 90 to 120 day period, with an emphasis on the last 30 days of about 50% of that marker. Liver function tests, because if your liver isn't functioning well, obviously it's going to put a strain, since the body's all interconnected, on your gut, your pancreas, and the like. Real simple liver function test, AST, ALT are great choices. I like high sensitivity C-reactive protein to see if there's any inflammatory issues at your artery level. And I like trackable devices. I'm wearing one now. I don't have any stock in the Oura Ring, the Whoop, the Oura Ring. All trackable devices are a great choice to see where you are, where you're going, and where you've been. So a lot of people say, hey, it's been mandated. And again, I'm not getting in pro-negative vaccine, all that kind of nonsense. I'm here to help people with health. So what about COVID-19 vaccine? What would you recommend? Well, just to keep your immune system strong, always before any kind of, even if it's a flu shot, whatever, good quality multivitamin, multimineral will balance the two key legs of your immune system. Vitamin D3 with K2, about 5,000 I use as a general recipe, a great choice for immune health. Quercetin. For me, quercetin is the girl with the curl. About 1 gram of quercetin per day will work great. Omega-3 fatty acids. Fish oils, great choice. I really don't care if they're algae or from the fish. Get yourself about 2 to 4 grams of omega-3 fatty acids per day. Branch chain amino acids are a great choice, and or glutamine, because you need that protein synthesis to have healing at the gut level. Also, NAC or glutathione. NAC can make glutathione. Glutathione is your master antioxidant. It is a great choice. Antioxidants obviously dim and quelch down free radicals. Probiotics, pro-life. Nothing's better than a probiotic, a good quality probiotic. My suggestion with probiotics is, and I do see some questions, so I'm going to answer all the questions. I should be ending in a few minutes. Don't go anywhere. Feed me with questions. I'm going to answer everything. Keep it coming. Probiotics, pro-life, great choice. You want biodiversity in the probiotics. You want a whole bunch of different types of probiotics. I'm going to do in the next few days a Facebook Live on probiotics and the things that you're looking for in a probiotic. Fortunately, people who get COVID-19 have something called long hauler syndrome. That's what we're here for, or long COVID and autoimmunity. So COVID-19 patients can develop something called autoantibodies that attack their own proteins. You're attacking your own antibodies. Antibodies are your defense mechanism. They're coming from your B cells. The process leads to inflammation that could trigger long COVID. Blood samples in a study, and this study was in +1 2001, blood samples from 32 patients that were plasma blood donors that were COVID-19 patients, plus 15 hospitalized patients. The results were very interesting in that 81% of the plasma donors and 93% of the hospital patients developed autoantibody that inhibited the ACE2 enzymes. So long COVID, those people that are long COVID have a high susceptibility to autoimmunity. You know, it's very funny. I want to make a little, take a little time and talk about that. Everybody talks about antibody tests, and everybody should test their antibody test. LabCorp's got a great antibody test. KBMO has a great antibody test. Having said that, you want to test your antibodies, and there's a little of a discussion and confusion in news. Your antibodies, especially IgG, which is the key one that you're testing for, should go up after any kind of vaccine, any kind of attack from a virus, a natural virus, that kind of stuff. The antibodies go up high. They should peak about 6 months, and they should start to wane after 6 months. The key to that is that memory cells are supposed to come. And the memory cells will remember it, because if your antibodies stay high for every time you have an assault, your blood would be like maple syrup. So I do believe there are going to be a lot more memory T cells that we'll be testing for. Unfortunately, I believe that most people's immune system are not functioning that well, and really should adhere to some of the suggestions that I make here today. Unfortunately, that's occurring, and I think that that's some of the issue, and it's very hard for the TV docs who do such a great job to really explain that in vast detail. So let's look at the multi-system manifestation of long COVID. So neurological problems that you'll have olfactory, you'll have a loss of sense of smell, headaches, cognitive impairment. Let me tell you something. One thing I see a lot of in the long haulers is a lot of cognitive impairment. You're seeing cognitive impairment because you're seeing damage to the mitochondria. The mitochondria, the powerhouse of the cells, the power plants, the batteries of energy in your body. The reason that you're seeing that is what's happening. You're seeing something called cellular danger response. Your mitochondria is sensory. Mitochondria's number one action is what I said, to make energy. Its number two is to help the immune system. Once energy comes down, your mitochondria senses something's going on and your immune system is under attack, like during a virus, if you will, or a bacterial infection, and it shuts off its power making process because it's cellular danger response. It senses the danger and then switches to immune properties that can have. And then you really fatigue. Your number one mitochondrial organ in your body is your brain. So you're getting a lot of fatigue. Also, the ability to pass the blood-brain barrier, this affinity to attach to the blood-brain barrier is extremely high with the SARS-CoV-2. And its diameter is 60 to 140 nanometers, which is so small it may be able to pierce the blood-brain barrier. So it's no surprise, number one, that it's affecting cognition, memory. Number two, fatigue. And number three, when it's in your brain, it's in your central nervous system, because your brain and your spinal cord are part of your central nervous system. Also, you'll see some issues with cardiovascular, tachycardia, palpitations, myocarditis. cerebral vascular disease, GI. Now, I was just at a chiropractic, I was at a whole bunch of chiropractic seminars, and a lot of people who said that they are post-COVID are seeing a lot of GI, gastrointestinal symptomology after contracting COVID. In that, they have a loss of appetite, there's diarrhea, vomiting, they've got leaky gut, and they have, unfortunately, a possible change in the gut microbiome. 80% of your immune cells are in your gut. Any damage to your gut is overall ruinous to your overall health. SARS-CoV-2 virus gets shedded through your gut. So if you have a leaky gut, the virus which you're trying to dispense of is going through your leaky gut back in your bloodstream, causing an immune issue or hyperinflammation. SARS-CoV-2 also, during the shedding process, can damage your very delicate gut lining. Single layer epithelial cell made up of proteins, has the thickness of a wet paper towel. Also, some interesting things. You're seeing some mental health things from the gut to brain axis, anxiety, depression, changes in emotions. It's a tough time for everybody. Pulmonary, that was originally what we saw a lot with SARS-CoV-2, pulmonary problems, cough, pulmonary fibrosis, and other kind of complications. Number one, over 80% of people that are long hauling fatigue, skin rash, hair loss, weakness, achiness in the muscles. COVID-19 is also damaging the kidneys. So hopefully I shared some interesting protocols with you. I see a litany of questions. Let me get to them. I'm happy everybody stayed with me. What are the most common long hauler syndromes? Great question. So the most common long hauler syndromes would be fatigue, muscle aches, gastrointestinal issues, any kind of mental fatigue, depression, anxiety, and the like. Of course, things also going on with your lungs and a lot of blood flow issues. So you're seeing a lot of people having blood flow issues, heart, kidney. This thing is gnarly, as we like to say. We have a quantum C400 symptomology that can find out what your body's asking for in terms, build your strong immune system. Great. It's good to hear that you're testing and helping people with their immune system. Big thumbs up from me. How much vitamin D daily? Good info, but speak slower, please. Yeah, I got my New York. I got it on for me right now. I'm rolling. Once I get on this stuff, I love to roll. But how much vitamin D daily? About 5,000 IUs a day. If you've never taken vitamin D, this is a generic answer. Please always, if you will, test for vitamin D levels. There's a great test. It's a MegaQuant vitamin D test. Anybody's interested, have that in my office, can tell you how to get it. Probably if you start off about 10,000 IUs of vitamin D with K1 and K2 for about a month, that was one of the studies, and then 5,000 IUs of vitamin D every day after that. When should vitamin D be repeated? I like to test my vitamin D in my patient base, and I'm going to see patients at 3 o'clock. I like to see vitamin D tested every 3 months because it'll take you about that long to really see the difference. You'll see a change in weeks, but in 3 months, you can see a vast difference. Some of the caveats with D3, just remember it's a fat-soluble vitamin. Please take it with food. You're more than welcome, Maria. Well, it's always my pleasure to share some different things. I'm going to get a little bit more active on social media. It's my pleasure. If you have any questions, feel free to ask them. I'll be looking at the thread as we go. I'm Dr. Rob Silverman, always yours in health.